Hi, my name is Jordan Finney, and this is my discussion for HA 575. My presentation is entitled Insurance and the Patient, an Ethical and Legal Discussion. Some background information on the changes of insurance. Changes in the health insurance options went into effect in 2013 with the opening of the health insurance marketplace. As many of you may know, the health insurance marketplace started with the Affordable Care Act. Consumers in states that opted into the marketplace or ran their own exchange could have access to insurance plans that would be potentially partially subsidized by federal monies to help decrease the overall cost for consumers. As someone that was a navigator for the very first year that this went into effect, there were some people that were able to get insurance plans for as low as $20 a month, and some were paying over $1,000 a month, all depending on income. As well, states had the option to expand their Medicaid programs with federal monies backing the expansion. A little bit of background of the state of New Hampshire. New Hampshire runs the joint option of the federal and state exchange, so we all utilized the lovely healthcare.gov that had so many issues when we first started. In 2014, the only choice that New Hampshire residents had was Anthem Blue Cross Blue Shield. It was kind of a monopoly on the system. Luckily, in 2015, 4 other insurance companies joined. There was Minuteman, Assurant, Harvard Pilgrim, and Maine Community Health Options all joined Anthem. So there was a lot more options. Pricing was not as great as the year before, but still the subsidies helped a lot of people. Medicaid expansion was passed into law in the state and was enacted in 2014. It was passed into law in March of 2014. People were able to start signing up right about July 2014. As of 2015, over 50,000 residents of New Hampshire have accessed either insurance through the exchange or through Medicaid expansion. So that's 50,000 patients that now have health insurance, thanks to the Affordable Care Act. A little bit of background about the facility that we're going to be talking about, Indian Stream Health Center. Indian Stream Health Center, otherwise known as ISHC, became a federally qualified health center in the uppermost of New Hampshire in 2006. Our service area is approximately 850 square miles. Current patient base of approximately 39,000 patients out of a potential 8,000 patients. Currently, right now, we have 3 physicians, 2 mid-levels, and 2 behavioral health social workers here. We became a patient-centered medical home with a Level 3 recognition in 2014. We employ over 50 staff, making us one of the bigger employers actually in the area. And we currently have 2 sites. Our main site is in Colebrook, New Hampshire, and we do have a satellite site in Canaan, Vermont. The Canaan, Vermont site is actually about maybe 500 feet from the line that separates Vermont and New Hampshire. The issue at hand here right now is that Indian Stream Health Center operates a sliding fee discount program. This program is designed to help uninsured and underinsured individuals gain access to care at a low cost. The program that we currently operate is divided into 5 categories that are based on household size and income. And we'll go through what this looks like. So right now you'll see we have slides A, B, C, D, and what we call a slide F, which is full pay. Our slide A goes from 0% federal poverty level to 100% of the poverty level. And again, this is based on your family size and your household income. These people currently, for any type of visits, pay a nominal fee of $10. Our slide B is anyone between 101% and 150% of the federal poverty level. They pay 75% of the charges associated with their visit. Our slide C is between 151 and 185% of the federal poverty level. They pay 50% of their charges associated. Slide D is 186 to 200% of the federal poverty level, and these patients pay 25% of any of the charges associated with their accounts. And anyone over 201% of the poverty level are a full pay and are not eligible for discounts through our program. So the ethical and legal issue at hand: should these Slide A patients, remember that's the 0 to 100% federal poverty level, have to apply for Medicaid expansion coverage prior to being granted low-cost access through Indian Stream's sliding fee discount program? Now, as you may or may not know, the Medicaid expansion actually covers anyone up to 135% of the poverty level, with a little bit of a plus or minus, so you can actually go up to 138%. So anybody that's in our Slide A category currently should theoretically qualify for Medicaid expansion coverage. As per the Health Resources and Services Administration, which is HRSA, they are the ones that give federal qualified health centers all of their grants and federal monies. All FQHCs, such as Indian Stream, must have a sliding fee discount program that utilizes household size and income to implement the discounts. The sliding fee discount program must include a schedule of fees, a schedule of discounts, and a board-approved policies for procedures for the program. This is something that Indian Stream Health Center definitely has already in place. Legal aspects of the program through HRSA. The sliding fee discount program can only be applicable to individuals and households that are at or below 200% of the poverty level. We definitely have that one all set. Full discounts or nominal charges have to be given for individuals or families that are at or below 100% FPL. Remember, that's our $10 that's set right now. Partial discounts can be given for individuals and families above 100% FPL and at or below 200%. So that is our percentages right now, the 75, 50, and 25%. There was a new PIN that was put out in September of 2014 by HRSA that says, although health centers cannot require patients to enroll in public or private insurance and or related third-party coverage, the health center must educate patients on options available to them based on their eligibility for insurance and or related third-party coverage. So this statement right here tells us that we cannot require patients to sign up for the Medicaid expansion, even though in the long run we may think it's better for them. We still have to be able to give them our sliding fee discount program through Indian Stream Health Center. But also noted in the HRSA, health centers must make every reasonable effort to obtain reimbursement from the third-party payers, including either public health insurance, Medicaid, CHIP, Medicare, and any other public assistance program, or private health insurance for patients that have such coverage. So, with that being said, if we can get them signed up for Medicaid, we definitely need to take advantage of that before using the federal grant monies to subsidize through our sliding fee discount program. Ethical considerations that we as FQHC staff members face is that we are willing to do whatever it takes to help a family or a patient. Medicaid coverage, if they are eligible, will cost even less than the sliding fee discount program. Medicaid coverage up here does not have any copays, so where somebody may come in 3 times a week for a visit, each time right now under our sliding fee discount program, it would cost them $10 a piece, which would be $30. If they had the Medicaid coverage, everything would be free to them. The patients enrolled in Medicaid would also have a much more comprehensive coverage system that extends outside of the Indian Stream organization. We do not have an emergency room. We do not have an inpatient facility. We are not associated with an ambulance service. We do not have specialists. We are a primary care center and behavioral health center. So if patients are in need of these other services, our sliding fee discount program is not going to be applicable to other organizations. Ethical aspects as well. And there's one way that Indian Stream can uphold social responsibility is to create a process that both helps educate the patient in their options for health coverage while assisting them with the paperwork aspects that are associated with our sliding fee discount program. We have a wonderful outreach program that actually helps patients fill out what we call the household assessment, and that is the paperwork for the sliding fee discount program. Now, while they are sitting down with the outreach workers, the patients are educated on the fact that do you know that you may be eligible for Medicaid coverage? Would you like to take a look at that as long as you're here? Because many of the same documents that you need to prove your income and status will be accepted for both our sliding fee discount program and for the Medicaid application. So if we can theoretically kill two birds with one stone like that, we're not only educating, but we're helping those patients get the best of both worlds. This not only helps the patient, but allows our facility to stay fiscally responsible as well. If we can get that patient signed up for our sliding fee discount program, and that works for them for a month, and then we get them on Medicaid coverage, it will help them out for that month, and then it will help both of us out after that, from a reimbursement standpoint, from a revenue standpoint, and from the patient's out-of-pocket expenses standpoint. So if there's any questions, thoughts, ideas, please leave them on this discussion. I would love to answer anything that you have. And here is a list of references to go along with this presentation. Hope you enjoyed, and you all have a good day. Bye.